Hello, it's Julie, owner and physical therapist at Lady Bits Physical Therapy. Today I want to talk about diastasis rectus abdominis, or DRA. This is a very common situation that happens in pregnancy or postpartum, and it can even happen in men, so this isn't just for women, so this is women or men. So what's occurring is the rectus abdominis muscle, the muscle you use when you do crunches or sit-ups. It's a trunk flexor, so it's very much curly muscle. That muscle actually starts to spread apart and pull apart, and you may feel as though you have a gap in your stomach. When you're laying down flat and you kind of peel your head and shoulders up off the floor, you might feel like everything splits apart. So congratulations, it's a diastasis. So how are we going to make this better? There are several components, and thanks to new research by Diane Lee in Canada, there is greater and greater understanding of what's happening and how we can rehabilitate this. So important to understand this is it's not just about that one muscle. This is a whole body situation. So there are several factors that are going to help you heal and recover, and there are factors that are going to make things worse. So the purpose of this video is for me to just kind of brush over some of these things, explain them so you understand them, and then refer you to my next video I make where I give you specific exercise instructions on how to help heal these tissues. So what's really important to understand is how much these muscles work together. So the diastasis, yes, it's a muscle separation, but what's really important is how much tension are you able to generate underneath that separation. Because a lot of complaints I get from my new moms are, I'm holding my baby and my baby kicks me and I feel like the foot goes straight into my guts. Or my children are walking over me and they're walking in their feet and hands go straight into my guts. So we really have to address the deeper muscles. So we're returning back to the core. So I'm going to talk about the transverse abdominis. It is our deepest abdominal muscle. There's nothing glamorous about it. You cannot see it. When you make it really, really strong, you still cannot see it. But it's super important. It's the deepest abdominal muscle we have. So our outermost layer is the external oblique, followed by the internal oblique, followed by the rectus abdominis, that six-pack which you can see, and finally underneath all of that is the transverse abdominis. It wraps around you like a corset. So it really does provide this beautiful stability from your ribs all the way down to your pelvis, and yes, it attaches to these pelvic bones down here. So that core muscle is super important, and that's what's getting stretched as you're growing with pregnancy. And it might be getting stretched so far that your body kind of loses the ability to engage that muscle, especially postpartum. So your body is really smart, and if you're weak in this really important core muscle, your body is going to make up for that. It has to find stability somewhere else. So what's really important to keep in mind with this condition is it's not just about closing the gap. It's not just about what's happening right here. It's about what's happening between your shoulders and your pelvis, because you don't want to make it worse. We want to make things better, but the body is so smart. So what the body's going to do is take the other muscles that help give stability, and it's going to make them tighter very often. So what we tend to find when there's a diastasis or weakness along the front of the body is your body's going to try to create stability somewhere else. So the other core muscles, your diaphragm, you've got your multifidus and your lumbar spine, and then your pelvic floor will try to make up for it. So if you have a diastasis, I often see kind of one of two things happening. Either the pelvic floor is very weak because you've given birth and you've been through all those changes, and so you have weakness of the pelvic floor and weakness in the front abdominal wall, and everything's kind of weak. Or the pelvic floor can try to help give you some stability because you're so unstable in the front, so the pelvic floor may actually become very tight. And it's hard for you to know without going to a women's health physical therapist and getting a real assessment to find out what's really going on with that component. It's really important to know what's going on with your pelvic floor. So I really encourage you to go see a women's health physical therapist and get yourself checked out before you start on any regimented exercise program. That being said, let's continue. So the pelvic floor may get very tight to try to help stabilize you. Also, your diaphragm can get really, really tight to try to help stabilize you, as can your internal or external obliques. It's very common to see a woman with a diastasis. You have this loose softness in the front, but very tight, restricted ribs because those obliques are trying to give you some stability. So it's oftentimes that you see these ribs are really tight and they don't have a lot of mobility, and there's a lot of little trigger points in the obliques and even the rectus themselves, and yet there's this soft kind of poochy pouch in the front. So how are you going to heal your diastasis? I always recommend go see a women's health PT so you can get a really good assessment of how your body is compensating, because you might need help from a physical therapist to kind of undo some of these compensation patterns, especially the fascial component. So if a muscle is separating this way, you have to think of all these layers of connective tissue that's also retracting back around. So I hear oftentimes from women with diastasis is, you know, I'm really sore back here, my low back, some back pain, and when I get my hands on their bodies, I can't tell you how many times I'm feeling all this jammed up connective tissue all around these bones, because this muscle wraps all the way around your body. So as it's retracting, it's taking all that connective tissue with it. So you can exercise till you're blue in the face, but if your fascia has started to retract and pull things this way, you need someone to get their hands on you and help bring things back around and address the fascial components. I often find restrictions all the way up in the ribs, you know, on both sides and in the back. Your body is super smart and super wonderful, but it's really important to have someone address those components, because as you're working so hard and doing your exercises and trying to heal and strengthen in the front, you've got to free up everything all the way around so that fascia can heal and come back together. So there really is an important fascial component and manual therapy component in helping your diastasis heal, and often even just a few sessions with a therapist can make a really big difference in that. It's not 3 times a week for a whole bunch of weeks. It's not that type of thing, but just to have someone give you a really good assessment and take really good care of your fascia to make sure that you're getting an all-around care. So with all that being said, we don't want to be too restricted in the diaphragm, we don't want to be too restricted in the pelvic floor, but we do want to return stability to the system. So there are things that you might be doing that might be making it worse. So we're going to talk about how we breathe, and I've addressed breathing in other videos, but as a quick review, women with diastasis tend to be upper chest breathers because they're very restricted in these lower ribs, their diaphragm's really holding on, so you might find that you're just breathing in the upper chest. I often see also women who become belly breathers, where they're really just breathing into their belly, and then all that pressure with every breath all day long is just pushing those tissues out. So it's a really good time to focus on your diaphragmatic breathing. You know, get your hands around your lower rib cage, and your ribs should expand out like an umbrella, lateral expansion. And if you're struggling to find that expansion again, I do recommend going to see a PT who can help you. So when you inhale, you should feel those ribs expand around you. And as you exhale, they should come back together. And how you breathe with movement is also important. So you want to engage that transverse abdominis before you execute movements, before you get out of a chair, get out of bed, or roll over, or stand up. It's good to help turn that muscle on. So how do you activate your transverse abdominis? How do you turn it on before you do a movement? Well, the easiest way to do it is blow. As I blow, I feel my belly button gently pull in towards my spine. That is my transversus working. So I'm not clenching, I'm not scrunching, I'm just blowing, and I'm gently feeling my belly button come back towards my spine. So just by doing that little blowing motion, it kind of engages that muscle, gives you stability, and then you can stand up and go. So I do recommend engaging those muscles gently with a little exhale, and then going. It can just be a second before you move, but just to turn that stability on so your body's not looking to find that stability elsewhere. What else am I forgetting? There's so much. So this is just kind of the once over, what's going on, what do we want to do? So we want to return the stability to the system. We definitely want to heal these tissues here. We don't want to keep stretching them out. I do say, you know, if you're fresh postpartum, it's good to avoid the crunches, avoid the sit-ups, most especially if you have a diastasis. Now is not the time to be doing a bunch of repeated movements like this. They can come back later as you heal. But if you're fresh, it's really good to just avoid a lot of that, you know, repetitive things that are going to put pressure on the front of your abdominal wall, and you're going to feel things bulging. So that's the diastasis talk for today. Follow this up with my next video. I'm going to be showing different ways of activating your transverse abdominis so we can create tension in that front abdominal wall and heal those tissues so that you have all the strength and stability you need to execute every other movement and exercise you want for the rest of your life. So it's not necessarily about closing the gap. The gap will probably close and diminish as you get going in your healing journey. But it's most important that we're creating tension inside of that gap, that deeper abdominal layer, that transverse abdominis, is creating tension for you, giving you the support that you need. So as we go through the exercises on the next video, I'm going to constantly be asking you to place your hand on your belly button and feel what kind of tension you're creating. So I will see you in my next video. Feel free to email me if you have questions, julie@ladybitspt.com, and my website, ladybitspt.com. And I hope you have a wonderful day. Like, subscribe, and share, and I'll see you soon. Take care. Bye-bye.